In this video, we'll be talking about the truth about aging and facial structure. My name is Dr. Sanan. I'm a double board certified facial plastic surgeon practicing in Boston, Massachusetts, and I'd like to talk to you about the way our faces age. When we talk about aging, many people think it's related to wrinkles, loss of skin elasticity, but in reality, it's much deeper than that. Aging in the face starts from the ground level, which is your bony layer. With age, your bone tends to resorb, meaning if you had high cheekbones or a defined jawline, with age that tends to go away. The next layer on top of the bone is called the soft tissue layer. The soft tissue layer is made up of fat compartments and made up of muscle layers. It also has arteries, veins, and nerves in it. This layer has many changes to it, which we'll get into later. The last layer, meaning the bottom being the bone, the middle layer being tissue, the top layer is your skin. People think skin aging in terms of wrinkles and loss of elasticity is the root cause of aging, but that's incorrect. Because of this incorrect thought process, skin creams and lotions can only get you so far in reversing the aging process. The same thing holds true for facial fillers. If you have a lot of looseness to your skin and muscle layer, fillers or any sort of volumizers will not lift. That's a fallacy that people don't realize is true. So the truth about aging is the bone resorbs with time. Unfortunately, you really can't do much about the bone resorption. However, you focus on the middle layer, which is the soft tissue layer, and the superficial layer, which is the skin. The soft tissue layer is composed of fat compartments, which some wither away with time, some descend with time. With a deep plane facelift and neck lift, you're able to mobilize the deep fat compartments of your cheek, going from the corner of your eye all the way to the corner of your smile line called the nasolabial fold. You're able to lift them vertically, therefore bringing the cheek fat pad into a higher, more natural position. In addition, you're able to work on the muscle layer. The muscle layer of the neck, called the platysma, is contiguous with the muscle layer of the face, called the smaz. Both of these layers descend with time. With a deep plane operation, you're able to lift both the smaz layer and the platysma layer vertically, therefore bringing the clock back 10 plus years. When I do a facial rejuvenation consultation and operation, I talk to patients about this concept of the lift and fill. Lifting the deeper tissue layers, the smaz layer and the platysma, allow you to bring the contours of the face back to where they were about a decade ago. However, you also have to account for the fact that you've lost volume with time. My preference for volume restoration is fat grafting. Fat grafting has come a long way, and you can purify the fat into microfat and nanofat, which serves a different purpose in terms of structure, but also stem cell-rich adipose cells, which are fat cells, in order to give the skin an improvement in its quality. The combination of lifting the soft tissue structures and filling the areas of volume loss creates a very natural and refreshed look for my patients. The icing on the cake is the skin layer. During a facelift and neck lift, yes, you do remove extra skin from the face and the neck. However, you're trying to improve the skin quality and texture. My preference for improving the skin quality and texture is a CO2 laser. This laser resurfacing is an ablative laser procedure that I combine at the same time as your deep plane facelift and neck lift. This allows me to resurface your skin. Think of it like a medical grade sunburn. It's a very controlled injury to the skin, but the goal here is to promote new collagen growth and new skin growth, which will improve the fine lines that you have in different parts of your face and your neck, and also give the skin a brightness as a result of new skin growing in. The combination of the lift and fill technique between a deep plane facelift and neck lift, fat grafting, volume restoration, and CO2 laser resurfacing of your skin is the trifecta to get you the most natural and refreshed look without looking over-pulled and overdone, which is one of the fears of an older school facelift. The goal when you're trying to correct facial aging and improve facial aging is to make sure a person heals and they don't look over-pulled or overdone. The goal is to create a younger version of yourself that you recognize. So how do you do this? You lift the face vertically with a deep plane facelift and neck lift. You do fat grafting to restore volume loss. You do a CO2 laser to improve the fine lines and skin texture. The combination of these techniques and my approach to facial rejuvenation is what sets me apart from other surgeons. My goal is to make sure that you recognize a younger version of yourself, that your family and friends say to you, you look awesome, but they can't figure out what exactly was done. My patients do not look over-pulled or overdone. Rather, they look like a well-rested version of themselves. If you're interested in seeing me for consultation or want to discuss facial aging more in detail, please reach out to my office through my website, drsanan.com, or call our office, and I look forward to meeting you in consultation. If you enjoyed this video, please like it and subscribe to my channel. Thank you.